Good morning. My name is Joe Doherty. I'm the Director of Public Affairs for the Utah Department of Public Safety and the state's COVID-19 response. Welcome to our briefing for Monday, November 23rd, 2020. Today our speakers will include Governor Herbert, Dr. Angela Dunn, the state epidemiologist, Rich Saunders, the Interim Executive Director of the Department of Health, and Taylor Randall, Dean of the Eccles Business School at the University of Utah. Governor Herbert.
Well, thank you, Joe, and welcome once again. A little unusual. We have a short week because it's Thanksgiving, and so we wanted to give information today on a Monday, which is a little bit unusual. But thanks for those who are participating. We appreciate, again, the media helping us get the information out. We still are in challenging times. I'm sure that's not a surprise to anybody as we see the case counts continue to, they're kind of leveling off a little bit now, but still way too high. We'll have new numbers today, which will show us a little bit of hope as we go forward. But in spite of the challenge we face as Utahns and as Americans and literally around the world, as we have this Thanksgiving week, I hope we have opportunities to reflect upon all the things we should be thankful for, which there are many. It really is wanting to foster an attitude of gratitude for all of us because we have a lot to be thankful for this Thanksgiving time. And we hope that people will have the opportunity to celebrate Thanksgiving. But we want you to not only have a happy Thanksgiving, but a safe Thanksgiving. So we'll remind you all about the protocols, which you've heard many, many times before, but are no less important today than they were, a few months ago. As we have this opportunity to pause from our work and give thanks. Again, remember to have a safe practice as you gather. You increase the risk when you bring people into your home that are from outside of the four walls of your house. That's just a harsh reality of what the data shows us. So bringing people in from outside your walls is going to increase the risk of you having somebody that will share with you the COVID-19 virus. When you gather, if you're gathering together, you should wear a mask. Along with social distancing, the combination of both those things will help, again, minimize risk. And as you gather, the smaller numbers that you gather with, the safer you will be. Again, smaller is better as far as minimizing risk. I had a doctor call me and say, you need to emphasize more, Gary, about washing of your hands. That's a part of the protocol. We talk about hygiene, appropriate hygiene, but we need to wash our hands regularly. With hot water and soap. If you don't have hand sanitizer, that could be used as an augmentation of hand washing. But again, that's how we transmit the disease, the virus around with our hands. And so wash your hands 20 seconds. We've talked about singing happy birthday to yourself twice, and that gives you the time to wash your hands. We also would encourage you, again, this Thanksgiving season, not to have potluck dinners. Not to have people bring, one from outside your household, but then to bring food. The food should be prepared by one person and dished out by one person too, and that person should be wearing masks when they prepare the food. So again, keep it short. The gathering together not only should be small in number, but it should be in a short duration. I know this is contrary to Thanksgiving and football and all we have on television that day, but again, just if we want to minimize the risk, those are the protocols that you should follow. We hope we're going to be seeing the effects of this pause we've put in place. And I think there's indications that we, in fact, are starting to flatten out a bit. We have another week to go, really, to kind of test what we've done in modifying our system through our last health order. But we are asking people to stay the course one more week and see what we can do there. We certainly are taking steps to increase testing. We mentioned that a week ago too, that we'd like to increase our testing by, 2 or 3 times. We'd like to be able to do 250 to 300,000 tests a week. And we think that will allow us to find people and isolate them to help slow the spread, find out really who's got it and what we need to do, in fact, to isolate them and slow the spread. We have a particular emphasis on our younger people, our college-age students. And the casual gatherings they tend to be involved with. And so that's going to be a major emphasis increased testing for those who are asymptomatic. Again, this is an evolution of learning. We started out not believing that people that were asymptomatic could spread the virus. We now know that they can and do. And so we're trying to get everybody tested, including those who have no symptoms, to find and isolate them. And we all know that I think for the first time in a long while, we see a little daylight at the end of the tunnel. The fact that we have now vaccines which are made available or going to be made available in the next couple of weeks that have 95% effectiveness when it comes to vaccinating us against COVID-19, that should give us hope as we see some daylight at the end of the tunnel as we're moving forward. So the next 2 or 3 weeks, I think we'll see our first opportunities here in the state of Utah to inoculate people, and we'll look forward to that opportunity. That will be kind of a crescendo, so as we get into the spring of next year, 2021, around, I think, probably around March, April, we'll see the vaccine being made available to all in the general population. So again, I think there's reason to be thankful and grateful for where we're at and the direction that we're moving in. So again, my last comment should be thankful, be careful. Follow the medical and science recommendations we have a safe and happy holidays. And if we do that, we'll be around for the holidays for next year too. And that's an important thing. So with that, let me turn some time over to Dr. Dunn, and she can give us the latest numbers. Dr. Dunn?
Good morning. Our 7-day rolling average of new cases is now at 3,349. This measure continues to increase throughout our state. Our rolling day percent positivity is 23.6%. And this measure is actually starting to see some stabilization as a result of the increased testing we're doing across the state. We continue to encourage all who need a test to get one. But I also want to note that everyone who wants a test can now get one by going to testutah.com. Even if you don't have any symptoms or you haven't been a close contact, you can now go to testutah.com and schedule a test. And now I'm going to turn the time over to Rich Saunders, who has information about new public health orders.
Thank you, Dr. Dunn, Governor Herbert. It's good to be with you today. As the governor mentioned earlier, the executive order and the public health order that has been in place and will be in place until midnight tonight will come to an end, expiring. And when those do come to an end, we'll have a new public health order that will take the place and return us back to the transmission index that was in place before this 2-week pause occurred. As a reminder, each week the counties are placed in a high or moderate or low transmission level based on the specific data about the spread of the COVID-19 virus in their communities. We consider, again, a 14-day case rate, a 7-day positivity rate in each county, and then a 7-day statewide ICU utilization to determine what level a county is placed in. And at midnight tonight, when the transmission index is re-implemented, 26 of the 29 counties in Utah will be placed in the high transmission category. 3 counties, Daggett, Paiute, and Rich, will be in the low transmission category. The system, the transmission index system, should be familiar with most, but there's some changes that and some nuances that I will discuss with you now, in addition to just reminding each of us of some of the main areas that need to be paid attention to in the transmission index. First of all, as the governor mentioned, masks continue to be required in all counties across the state, regardless of the transmission level. Masks are to be worn in public indoor settings and outdoors when physical distancing is not feasible. Social gatherings, again, as the governor stated last week and again today, we're trying not to prescribe how many people should be in your individual home. We want to leave that to your discretion. So we've removed the limit on the number of people who can attend a private social gathering on your own private property. But we still want to promote the best practices as the governor has done. So as for social gatherings, we still recommend gathering only with those of your same household. That is the safest way. But if you do gather with other households outside of your own, we recommend keeping the numbers small. And practice physical distancing wherever you can and wearing masks, even though you're among family and friends. The exception to this is, of course, when you're with members of your own household. We also suggest, for example, that you kind of think through the numbers of people that would attend social gatherings. For example, in high transmission areas, you might consider 10 as a number, 10 or fewer. And in low transmission areas, we might consider 50 or fewer. The key there is to just remember that smaller numbers are safer events. Just a reminder that in restaurants and bars, in high transmission counties, 6 feet distancing is required between parties, and masks are to be worn at all times unless eating or drinking, and alcohol sales must stop also at 10 p.m. Public gatherings, these are the larger gatherings that have an event host, like theaters and sporting events, weddings, entertainment venues. Remember that masks are required to be worn, and 6-foot physical distancing between household groups is required at all times, including the egress and ingress on those venues. High transmission counties, this is what I've just shared is pertaining to high transmission counties. Performers and athletes are exempt to this while they're actively performing at these events, and exceptions to physical distancing requirements at these venues may be granted by county executives. And across all transmission levels, the following measures are being implemented. So a lot of you have been asking about extracurricular activities that were put on hold for the last 2 weeks. The state continues to believe that learning in person is the best option for Utah students, and we want to do everything we can to try to preserve this. Now, focusing on extracurricular activities, beginning next Monday, a week from today, all participants in high school extracurricular activities, including the coaches, trainers, and staff, will be required to be tested every other week. And anyone who receives a positive test result will not be allowed to participate in the high school extracurricular activity until they've completed their isolation period. With club sports, and this continues to be a significant concern to us, although we love club sports and we love for them to take place, what we're asking, and we are placing under public health order, is that participants in club sports, recreation leagues, dance studios, gymnastics gyms, volleyball gyms, and all of these types of venues and activities, we are requiring that symptoms be checked and exposure is checked, or in other words, asking each participant whether or not they've been in an exposure situation within the past 2 weeks. So this symptom and exposure checking is to take place before each in-person activity, including practices. Businesses will now be allowed to have a little different quarantine protocol. And finally, similar to the K-12 protocols that we've implemented in the recent weeks, we're offering businesses an opportunity to have quarantined employees return to the workplace earlier than previously required. If an employee was exposed in the workplace, for example, that employee can be tested on day 7 or later of the quarantine, and a negative test will clear that employee to return to work. We're grateful for the team, including Dr. Joe Miner, Angela Dunn, and other epidemiologists that have worked through this to be able to put this in place. This is at the discretion of the business owner, however. So as you can see, we continue to adapt our response and trying to implement changes as we see the changes in data and other information. They're sensible. These restrictions or guidelines that are placed in the public health order are designed to balance the individual liberties and our collective well-being. They're aimed to protect lives and livelihoods. So I hope during this time that we can think about one another and what we can do as individuals in the name of a much higher good and a common good to all. Thank you for your time and your participation in the public health order and all that you're doing. And we wish you a happy Thanksgiving this week. Thank you.
Well, good morning, everyone. As we see a surge of COVID cases across the nation, people continue to be worried about the state of our economy, and particularly the strength of the economy of the state of Utah. We're fortunate our economy continues to outperform much of the nation. However, over 67,000 Utahns remain out of work. Our economy on a year-on-year basis still exhibits some contraction. And finally, our CARES Act stimulus funds are nearly all spent. So even in one of the best performing economies in the nation, I think we should view our economic health as relatively fragile. We really got to focus on continued vigilance on the health side, but we've also got to continue to focus on protecting our businesses and our economy. Today, however, we come to you with some good news to share. We've always known for months that wearing masks is quite helpful to the health of our community. Today, we also can report on some findings that suggest that mask wearing is also good for our economy. Now, that's a pretty big deal because we've got to find a way to bridge the health of our economy between now and when vaccines are widely distributed. Said another way, mask wearing creates a triple play. It reduces COVID spread in our communities, but it also increases consumer mobility in stores and restaurants and also increases consumer spending. Well, how do we know this? Some researchers at the Mariner S. Eccles Institute of Economics and Quantitative Analysis at the David Eccles School of Business have analyzed all 3,142 U.S. counties and the mask orders that were put in place in those counties. Their findings are as follows. First, COVID-19 cases decrease after these mask orders are put in place. Second, the combination of low case counts and mask requirements actually increase consumer activity in the economy, and we see that in two measures. First, we see that consumer mobility increases as they visit more stores, and second, we also see that spending increases in these counties. The final and very important policy finding to note is that state mask mandates are the key to this, whereas county mandates do not have near as much effect. So what are the recommendations then, and what does it mean for state policymakers? First, we now have some significant evidence that health and economics go hand in hand. At the core of this relationship is mask wearing and consumer confidence. There appears to be an increased ability for consumers to engage in our economy if they feel safe and they are wearing masks. Second, the statewide mask mandates play a real key role in this, right? We see that in the cases of statewide mandates, we get the triple play. We see reducing COVID cases, increased mobility, and also increased consumer spending. That is not the case if a county goes it alone. So I guess in conclusion, I'd echo our governor's sentiment and when he provided this following call to action. Mask up, Utah, both to protect our health and our businesses and our jobs. At 1:30 today, a faculty member from the Eccles School of Business, Nathan Siegert, and one of the lead researchers on this study will be available to explain his findings in greater depth. Thank you.
Well, thank you, Dean Randall. That is exciting news. We find that not only does it help minimize the risk of catching and spreading the virus by wearing a mask, we also find that it's very helpful for our economy because people feel safe about moving around and about, and that's how the economy continues to prosper. So that's good information. Again, later today, a more in-depth discussion about the study that's been done by the University of Utah. Dr. Dunn and Director Saunders, we appreciate your comments too. With that, we'll just turn it open for some questions for a few minutes here.
Hi, Governor. It's Ben Winslow with Fox 13. I wanted to ask if you have plans for our hospitals continue to almost exceed capacity, and what's your plans if cases continue to climb? Do you have plans if Thanksgiving turns into a super spreader event because people still gather?
Well, there's always contingency plans whether there's Thanksgiving or not, Ben. The hospitals already have put into place what they need to do for critical care and the ability to kind of triage so that those who have the most serious ailments go to the top of the line and others would be, in fact, go to the end of the line. I don't like the prospects of that happening, but clearly, as you've pointed out, we're kind of at the full occupancy rate when it comes to ICU beds. We have other beds which are not ICU beds, which are available, and that people will get care. They just won't have as good of care. And so that behooves all of us then to take this seriously and to do our part. I think people have been responding to what we've put down as good practices. I think there are more people wearing masks than ever before. I think people are more conscious of social distancing and good hygiene, and I hope that continues. And we all really need to stay the course and not, relax here because we are at critical stage. Now, again, the next, 4 or 5 months is going to be critical if we continue to practice these protocols, because then the vaccine will come in. It'll overlap as far as receiving the vaccine, but we can't say, we got the vaccine, now we can quit doing these other things. It's going to take us probably till the summer of next year, I believe, based on the expert opinions of the medical advice that we're receiving here in Utah and really from the CDC and others. We need to continue to practice protocols and then hopefully we'll turn 2021 into a recovery year by this coming summer. I really think that's possible. But again, we all need to still do our part and not relax. Next question.
Good morning, Governor. Christina Flores with KUTV. After you imposed the emergency order, when did you expect that things might turn around? We had 4,000 cases at the end of last week. That doesn't seem like a turnaround or like we're doing any better.
Yeah, I would hope that we could have some kind of stabilization. It looks like our positivity rate maybe has dipped just a little bit, but we're certainly not out of the woods now. We put the emergency order in place. It will continue most all of it, except for the requirement to have only inside of your home members of your household. We think that's a little bit of a step of intrusion into people's privacy. We're a little concerned about that. Doesn't mean the risk is any less. In fact, if anything, it may be more because of the propensity for us to gather together as families and friends during Thanksgiving holiday. So a word to the wise, again, you understand. I don't think there's anybody really in the state that does not understand what we should be doing. We just hope that they do it. And we have laws in place on mask wearing statewide now. We have laws in place on what businesses should be doing when it comes to requiring masks in their establishment, having signage in place to make sure that that occurs. We're having solicitation of people involved in business to join the Stay Safe to Stay Open protocols and organization sponsored by Chambers of Commerce. A lot of things being done out there. PSAs, we see a lot of announcements on television and radio and the media to help us to remember what we should be doing if we want to slow the spread and bend the curve. But unless we do it, it won't happen. It doesn't matter what the protocols are out there that we're asked to do. If we don't do them, it'll have no effect. So I'm hopeful. Again, this is the most dangerous time of the year because of being indoors, cold weather, and the holiday season where we tend to get together. We're just telling people, take a pause on that and try to keep your gatherings small and short in duration. Next question.
Hi, can you hear me?
Yes.
Thank you. In the 2 weeks since the emergency health order was implemented, it looks like cases, hospitalizations, and deaths have risen pretty precipitously. And now the health order is being relaxed in some ways. So my question is, does that mean we've seen the most stringent restrictions that we're going to see in Utah, like no matter how high the cases and hospitalizations get? And if not, what exactly would trigger further restrictions? Is there any plan if we get up to 5,000 cases a day and 100% hospital capacity?
Everybody's looking for the kind of the magic formula, the magic bullet to solve the problem. And unfortunately, I don't think there is one. It's really, how do we endure? How do we get through this challenging time with a minimal amount of damage to our health care, to our health of our people, including mortality? And how do we, in fact, keep the economy functioning? Because if it doesn't, it has its own sets of problems. And so as I look around, I was on a phone call here just this last week with governors from around the country, and nobody has the exact right answer. Everybody's trying different things and certainly are experimenting. And what seems to work in one state is not working in other states, or what worked in the state at one time is now not working. Everybody's going through these surges right now, and again, it's probably a reflection of us gathering together and the colder weather, we're getting more indoors and less outdoors. But as I look at those who've tried it in different ways, I'll just use two extremes. New York tried to close everything down. Their economy is still suffering from that effort, and in New York, it's pretty barren compared to the bustle and hustle that they've had before. But their mortality rate is about 174 deaths per 100,000 people, one of the highest in the nation. But they closed everything down and their economy is still suffering. You could go to South Dakota, and again, I'm not picking on these states because we all have got ups and downs in all the respective 50 states and 5 territories, as well as looking around the world. But in South Dakota, they took the other point of view, which is we're going to leave everything open. We're not going to close anything down. We're not going to make any restrictions on anybody and just have a laissez-faire approach to this. Well, they now have the 3rd highest death rate, mortality rate in the world. Their infection and case rates are going through the roof. And so that didn't seem to be working very well either. Hawaii, which is an island, they've tried just excluding people from coming to visit them. If you fly into Hawaii, you'll be quarantined for 14 days. Well, that's pretty well shut down their economy too. There's about 0 there, but they have low case numbers. So we've tried to, from the very beginning, find that balance point where we have optimal benefit of protecting people's health and also having the economy continue to prosper. And our death rate compared to, say, New York at 174, ours is about 20 per 100,000. So considerably less, about 8 times less. You compare it with other states, if we had the same rates as they have in South Dakota, which is the open system, we'd, instead of having 760 deaths, we'd end up having probably about 2,500 deaths today if we follow that same infection and mortality rate that they have in South Dakota. So our unemployment rate right now is about 4.1%. We have actually more people now engaged in the workforce now than we had pre-pandemic, with people actually engaged and looking, there are jobs available. We know that there are people who are suffering and hurting, and on both sides of the equation, economically and healthcare wise. We're trying to find a way to all of us come together to get that optimal benefit. And although we're not perfect, I think we've done a pretty good job, all things considered, compared to other states. So again, help is on the way with a vaccine. Let's continue to follow the protocols of social distancing, which is the best thing you can do. Be away from people who potentially have the virus. Wear a mask. We see the benefits of minimizing risk. It doesn't mean it's risk-free. People sometimes get that mixed up. It just minimizes the risk of you catching or spreading the virus. So mask up, and then have social distancing, and then wash your hands. Have appropriate protocol. And by the way, common sense, if you're sick, don't go to work. Don't take the chance. And we're trying to emphasize now increased testing. So again, I think we're in a good place. Can other things happen down the road? Sure. We'd have to analyze it. We meet together with our our brain trust, as it were, of about 200 people involved in healthcare and medicine and science and data analysis and the economy to find out with our unified command, what should we be doing policy-wise? Every day, that's a discussion. So I don't know what's going to happen. I hope that we all just do the things we know we should be doing, and we won't have to worry about it being any worse, and hopefully it'll start getting better.
But is there a plan for, modeling out or just anticipating, projecting, if it does get worse, which it seems very, very likely it will, given the increasing case rates that we're seeing even today, is there no trigger for, say, shutting down restaurants?
I'll have Rich come in and can talk about that, what we're getting from the Department of Health. We have a plan in place. We anticipate that's going to work. We believe people will, in fact, follow the recommendations we're giving. Can that be modified? Absolutely.
I guess, what is that belief based on? Because it seems like these recommendations haven't been followed for the past, 7 months or whatever.
Well, the fact of the matter, we're not as bad as some places in the country, and we are, in fact, better than most. That gives us at least some optimism. But again, we're in the middle of a pandemic. I understand it. We all get it. It's a virus that's invisible. It's, we don't know if we are carrying it. We now find the latest medicine tells us if you're asymptomatic, you can still spread it to other people. So it's a tough challenge. There's no question about it. And we're battling just like every other state. And I think we're doing better than most every other state. So doesn't mean we're where we want to be, but there's no reason to give up hope. Rich, you got anything you want to say? No, we're good. Next question.
Hi, this question is for Dr. Dunn. This is Haley Hendricks with ABC4. Okay, so over the weekend, Dr. Dunn, you posted a link online to a COVID-19 risk assessment tool that Utahns can use to see the chance a person may have the virus, specifically at a gathering. Can you talk about this tool, why you support it, and how you hope Utahns can utilize this, especially with the upcoming holidays and the increased COVID cases we're seeing?
So this is a risk assessment tool that's been built by Georgia Tech, and it's been used by a lot of health officials throughout the nation to really model out risks. So if you have X number of people at an event, what is the risk in your county of somebody actually being positive for COVID? And they update these numbers daily and the risk daily based on how many cases we report. So it's a really good tool to understand, for example, if you live in Salt Lake County and you have 15 people coming over for Thanksgiving, there's over a 50% chance that one of those individuals will have COVID, which then, of course, it magnifies the ability for COVID to spread beyond that group of 15 and into the community. And impacting our holidays throughout the winter and school returning in January and our businesses, et cetera. So I really encourage individuals, if you're thinking about going to an event or having an event at your home for the holidays, looking at that tool, using it for how many people are going to be at your event, what county you live in, and it'll really help you really understand, hopefully, that risk of somebody having COVID at that event.
Thank you very much.
Sure.
My question's also for Dr. Dunn as well. Good morning, Dr. Dunn. First of all, with the case, with the hospitalizations the way that they are right now, what is this holiday going to look like in our hospitals? And also for you, what kind of adjustments have you made to your typical holiday plans for this Thanksgiving?
Sure. So our hospitalizations that are going to happen over the next couple of weeks are a result of our cases that have happened in the past week. So we know that our hospitalizations are only going to increase throughout this holiday season. What we're trying to do is make sure that people understand this risk and change and alter their Thanksgiving holiday plans accordingly so that we don't continuously have this surge of our hospitals needing to alter the way they care for patients with both COVID and non-COVID. It is so essential that we take this opportunity in the last several months before a vaccine becomes available to not continuously increase the burden on our healthcare capacity. Personally, I am having Thanksgiving with the 3 other individuals that live in my household. We're ordering Thanksgiving from a local restaurant, and we're going to hang out together and use that time to have some quality time, both indoors and outdoors, we usually have a feast with local friends who also don't have family in the region, but we're going to just do it solo this year because of COVID.
Hi, it's Ashley Imlay with the Deseret News. So kind of going back to what we've been talking about, the Utah hospital leaders have asked people not to gather for Thanksgiving with those outside of their household. Why lift the gathering restriction now? And can hospitals sustain an influx of cases while they're already overwhelmed?
We mentioned 2 weeks ago when we put the order in place that we're going to put a pause in place for 2 weeks and we'd lift it, and which we've done and are doing. We think it's a bit of a stretch to say to people of Utah and our citizens, we're going to tell you what you can do within the walls of your own home. That's a challenge for government overreach. And we certainly know that there's many people out there that think that is an overreach, and so we're concerned and sensitive about that issue. Doesn't mean the risk has been any less over the last 2 weeks, and we're asking people to voluntarily comply with good protocol. We're probably doing something right because we have people that say we've done way too much on the right, and we have people say we're not doing near enough on the left. And again, as I mentioned earlier, we've been trying to strive for that happy, optimal middle part where we in fact protect the health of the people and yet still have a healthy economy at the same time. And based on comparison, at least, to other states in the nation, we've done a pretty good job of threading that needle. Now, again, we want to make sure that people understand the facts, what the truth is, what they can do to protect themselves and their families, and then we would hope that they'd follow that good protocol. Wear the mask. We have people still refusing to wear a mask, and yet we find that not only does it help protect and slow the spread and minimize risk, it also helps open up the economy. We have people out there saying that the mandates actually have been harmful, but we find that the mandates we put in place actually now by study and research are actually helping to open up the economy and in fact having people have a good quality of life in spite of the pandemic. Now we can all do better. It's really an individual responsibility for all of us to do the best we can. And if we'll take that responsibility, I think we can have greater success. And I'm hopeful that that's what's going to happen. We're learning as we go. And again, more and more people of Utah are taking on that responsibility to follow the good recommendations of our medical experts.
Thank you. This is Chris Reed with St. George News. I have one question for Director Saunders and one question for Dean Randall. For Director Saunders, the return of the transmission index. Before, we were talking about not recommendations, but requirements about gatherings. Now we're talking about recommendations. So I guess just to help me understand, what's really the difference between being high, moderate, and low at this point? I mean, does it have any teeth? And for Dean Randall, concerning the study, you mentioned about state rather than county mandates having more of an effect. Did you determine about enforcement of those state mandates? In other words, if a mask mandate has more enforcement, does it have more effect? Does it make any difference? If you guys can address that.
So in response to your first question regarding differences between high, moderate, and low as it pertains to social gathering recommendations versus required by a public health order, what we have done is basically said there is no real differentiation in the public health order, but there is strong recommendation in how we are counseling or guiding people in the state of Utah to consider their gatherings in each of those levels. Obviously, low transmission level is, we would strive and do everything we can within we wish we could be there as a state. And that just simply says the transmission is not as high and social gatherings are not as risky, so we can expand those. In high, in contrast, the transmission level is very high. It's a very dangerous situation. But as the governor stated, in the name of trying to not intrude into people's private residence, we pulled back, and then we're giving the correct guidance to people. For example, recommending that gatherings be less than 10. So we're trying to say to the people, and hopefully we've all learned a lot here, and we can see what's happening, that people will make good judgment, good decisions, and when they're aware of the fact that they're in high, they will gather with less people. When they're in low, they can expand that. And that's kind of the differentiation between those three levels. And it is a recommendation at this point, but we strongly recommend it be considered. Taylor?
Just to repeat the question to make sure I've got it right, you wanted to know whether or not there was a distinguishing between enforcement in those counties that had mandates.
Well, not even the counties, but the states. In other words, does it make any difference if, let's say, there's less enforcement from a state perspective, or if it's just basically the hope that people do the right thing?
Yeah. So the researchers will be on at 1:30 to explain if they've looked at those nuances. To my knowledge, the study looks at whether or not there was a mandate put in place in those states. You would naturally guess that there is a variance in the compliance and the enforcement of that mandate, and there would be some hope that that would kind of on average tell you what the effects were. So I think the researcher will be able to speak to that more precisely this afternoon.
And just as a reminder, we do have a statewide mask mandate in place in all 29 counties.
Hey, so I have a brief question for Governor Herbert and then one for Dr. Dunn. I'm interested to know what the governor's Thanksgiving plans are. And then for Dr. Dunn, some counties across Utah have stopped contact tracing because they are so heavily burdened by cases. So for some health departments, it's all they can do to just notify a person of a positive test, and contacting their close contacts is just too much. But I've also heard from a local health official that a disease could be so prevalent that contact tracing doesn't really have an effect. So I'm wondering if we're past that point at a state level, and if not, whether we're planning to hire more contact tracers to make it through the winter.
What was the question for me again?
What are your
my
Thanksgiving
plan?
plans?
Okay.
Yeah.
Well, like most people, our Thanksgiving plans are not going to be anything like they've been in the past. I have a large family, and we all live within about 10 or 15 minutes of each other. We've been getting together every Sunday in times past, pre-pandemic, for Sunday dinners. That being said, our modification this year, we have one family that actually has had COVID-19, so they won't be spreading it. We'll be spending some time with them. And the rest of the families are going to be doing their own things in their own homes. Again, trying to follow the protocol as best that we can at this difficult time. And again, it's a matter of, we want to make sure we don't spread the risk, that we don't infect other members of our family. And so we're going to follow the recommendations that we've given here today.
So with regards to contact tracing, when we have thousands of cases every day with more people being out and about, each individual case is having more and more contacts and makes it very difficult to follow up in a timely manner for our local health departments and also our state health department. We are continuously hiring new contact tracers and building up that capacity. There definitely comes a point where we have to have a measured approach with individual behaviors to limit the number of contacts in addition to contact tracing, so that contact tracing is more efficient when each case has less contacts. So that's why it's so important to limit the number of close contacts we have each as individuals, so that the risk of spread to anybody else is much lower, and it allows contact tracing to be much, much more efficient. But we are looking for ways to bring technology into our contact tracing process, and constantly looking at ways to reprioritize contact tracing to make the most of it, given these hard times and the increase in cases. Thank you.
With that, we'll conclude our press conference. Let me just maybe mention a couple things in closing. As we have this Thanksgiving holiday time, it's easy for us to be glum. And again, there's reasons to be glum. It's a tough time for us all. But I do think back in terms of that first Thanksgiving when the Pilgrims came and the Mayflower landed at Plymouth Rock. And I happen to have a grandfather, his name was John Howland, who was on that ship. And 102 members, of which 45 of them died that first winter. They were in a bad place where they landed. They had malaria. and they got sick. It was a challenging time. 45 of the 102 died. My grandfather survived, actually married another member, Elizabeth Tilley, that was on the ship too, that became husband and wife and is part of my progenitors that I have great love and appreciation for their sacrifice, what they did, and I'm thankful for them. The next year, started their recovery, and as you all know, the first Thanksgiving, we had 90 members of the local Native American tribe there that shared that first Thanksgiving with them, helped the pilgrims get through that tough time, and started this kind of annual event of when we get together at harvest time and celebrate the bounties that life has given to us and the ability to work together, really, as exemplified by that first Thanksgiving. I see some similarities for us today as we are going through some troubled times. We've had really challenged with this epidemic, this pandemic that's gone around the world, and still wondering, what the solution is as we look for answers. I think we're finding some of them. We're, I think, learning as we go, but still we're in the depths of this challenging time, even though we see a little daylight at the end of the tunnel. I would hope that all of us take the opportunity to be thankful for the many blessings we do have for being members of this great country as Americans. And I think the greatest state in America here in Utah, where we have a lot of good people. I know I'm thankful for the doctors and the healthcare specialists who are spending extra time, overtime, and trying to help us find a way to heal people, to protect their health and help people recover. I'm grateful for people that are wearing masks. I hope all of us will kind of understand the importance of what we can do to contribute to the slowing the spread and minimizing risk by wearing the mask. I'm grateful for those who are doing that, finding a way to contribute to the solution, not being just a critic on the sidelines, being part of the problem. I appreciate the researchers and the scientists out there trying to find a way, and we now have a vaccine. A couple of them, maybe more on the way. We ought to be thankful for that. I appreciate the business people who are struggling out there and are trying to find a way to survive, and some even thrive during this challenging time. And the results of their efforts are we have this low unemployment rate, one of the lowest in the nation, fourth or fifth lowest in the nation at 4.1% unemployment rate. Many are still in double digits. So the fact that our business people are finding ways to innovate, ways to adapt, and find better ways for success through this is something we should all be thankful for. They're being creative and innovative and finding ways to survive. And certainly I would like to say that I'm grateful for our teachers. Teachers have a tough time in the classroom trying to find ways to protect their health and those of their students, but also provide an opportunity for them to learn. They are the rising generations. They're going to take over here in just a few years, and our teachers are really working very hard to make sure that the protocols are followed in school, that our students are learning, that they're progressing. And not only our teachers, but our district supervisors, our superintendents, our principals, our school boards, again, trying to help implement testing protocols in our schools. And I've been so impressed with people stepping up with a can-do attitude. And that's all of us. We need to have we can do this, and we will do this. That's something we ought to be thankful for. That's part of our heritage here in Utah, that can-do spirit of our pioneer ancestry, the can-do spirit of those who arrived at Plymouth Rock and the Mayflower. The heritage we have as Americans is one of can-do. We'll find a way, and we'll do it with the spirit of cooperation and collaboration. I hope all of us take a little extra time to thank the good Lord and nature for the successes that we've had here in Utah, and we'll continue to have them if we continue to work together. So thank you. God bless. Have a happy and safe Thanksgiving.
All right, this will conclude our briefing. Thank you for all your attendance for our interpreters in Spanish and American Sign Language. As a reminder, we have posted the new page with the transmission indexes live at coronavirus.utah.gov. Thank you very much.